The parent's concern is that the child does not speak, the child does not speak, the child does not interact. Don't immediately panic or sound the alarm, but go to a specialist who will understand this, right?
And he says what should be done next.
Exactly.
Sometimes parents do not notice that the child has a problem.
It is very important not to limit children, that is, to give them the opportunity to explore, touch, put things in their mouth, crawl, different textures, different materials, different colors.
Hello, our viewers. Today we will talk about a very cool topic. First of all, I want to thank Yuzko Studio for hosting us, allowing us to express our thoughts here and easily discuss a topic like children. This is a first for our channel. We went further. We want to talk about children, about child development, about features, so that you know and have up-to-date information. Therefore, today in our studio, we have Nadiia, a speech therapist, psychologist, psychotherapist. Hello, please introduce yourself.
Hello. Yes, I share the gratitude for the wonderful space to be here and share information that is important, first of all, I think, to many. As for me, I am Nadiia Kuryliuk by education, a correctional specialist speech therapist, special psychologist, and psychotherapist. That's it. Glad to be here, and thank you for the invitation.
Yes, I would like to talk today about children, about being informed and knowing in general how a child develops correctly, so that we can raise the alarm when there is any problem with a child. Especially about speech, for example, now, because everyone speaks differently. They say when a child starts talking, whether it's early or late. So the main thing I'm interested in first is, what do children and their parents come to you with?
I'll provide a little context. I am the owner of the Correctional Center Logos Progress. We, let's say, comprehensively help children with special educational needs. And in particular, I have a training academy where I share knowledge with colleagues that will be useful in practice. And the question is actually good. Yes, which children are most often referred? And as it may sound, probably today, the parent's request is the child does not speak. The child does not speak, the child does not interact, or the child may have aggressive emotional behavior. So most often, yes, the request is does not speak, does not interact, does not communicate, and various behavioral manifestations in children, let's say, here. And first of all, it's comprehensive work. That is, yes, it's targeted work by each specialist. Because it may seem that parents, I always use the iceberg example. And at the top, it's what parents notice first, it's speech. And it's, like when a boat is sailing and it might think it can sail around, but in reality, it's a big iceberg. And below, there are many important mechanisms that need to work harmoniously for the speaking process to occur. And very often, when parents come and say they are concerned about speech, it turns out that many mechanisms still require preliminary work. That is, the cognitive sphere, the emotional volitional sphere, the social sphere. Very often, it's the praxis area or the child's motor development, the saturation with various sensory analyzers. That's what's already underwater. And parents may not notice this.
And how should they pay attention? When should they come and understand that our child is not speaking? What time frame is given to these parents to raise the alarm and come to you?
I will probably give a deeper answer at the same time, so that parents can, yes, go back, analyze how it was, if there was something worth paying attention to. And I will go a little into the prenatal, natal, postnatal period. Yes. So it's actually a very close interaction. And the tendency is such that it seems to me the first markers can be noticed if there were difficulties in one of these periods, right? During childbirth, whether there was asphyxia, hypoxia, for example, right? So this is often when I collect the anamnesis from parents. I collect the anamnesis completely in order to understand what could have been the cause or what consequences there might have been. That is, it seems to me, if already during the gestation period, conception, gestation, childbirth, something could go wrong, this is already the first sign that it is worth monitoring the child's development, paying attention. And the brain is such an amazing thing. It can compensate for many processes, and in some cases, the compensation can be great, while in others, it may be less so. Therefore, by understanding how the pregnancy and birth went, you can notice and pay attention to any difficulties that occurred during this period. And further, within a year, I would say such red flags are whether the child maintains eye contact. That is closer to 6 months, the child already notices and emotionally responds with a smile to the mother's voice. She should, hear the voice and gradually turn her head towards the mother. So if this is not happening within the infant period, from the first month of birth to 1 year, this is also a red flag to pay attention to. That is visual contact, reaction to the mother's voice, emotional communication, smiles. Here, and if we talk about speech, the first preverbal period is when the child cries, yes, from birth. Their way of communication is screaming, crying, crying. And then it transitions into the cooing period and then into the babbling period. Gradually, the first words start to appear. And I think that already in the first year of life, you can notice a certain trend in the context, yes, of the first thing I mentioned about visual contact, positive emotional reaction, yes, when the child already responds to the mother's voice. Next, it's either the preverbal period in context, what kind of cry, what intensity, whether there is a cooing period, whether there is babbling, what kind of babbling, how enriched it is, or is it limited, whether the child can only vocalize, for example, up to 1 year, and then this can also be noted here. And in particular, I would also add a very important component, motor development. That is, there are still conditional norms for how a child should physically develop, right? First, they hold their head, then they turn over, then they sit up, then they crawl, then they walk. And if even at the motor level, yes, at the physical level, the child has a delay or there is at the extreme edge of the norm, or the child may skip some stages or even switch them around, this can also be a sign that yes, there may be a delay in language development, a delay in mental development. This is probably more from my own practice.
Yes.
Because I have been practicing for 14 years, first of all. And I already like this period when it's interesting to analyze.
Draws conclusions.
Yes, this, a selection of my work. Yes, the correlation, how it is connected with something. And so I like this profession. I would say I am in love and I make all specialists fall in love. In her case, yes. So I already see when parents have, they say, for example, we walked late or didn't sit, for example, or sat only at 1 year, and they walked closer to 2, right? There usually pediatricians refer for a massage and always ask, and what was the purpose of the massage, right? Or there was the head not supported. So this is already about, for example, okay, if there was a massage, then most likely there was an issue with muscle tone. If there is an issue with tone, yes, when the tone is tense or conversely relaxed, to make it clearer, then as a rule, for example, in the context of speech organs, it's also about tone.
Tone as well.
Yes, when there is hypertonia of the speech organs, then the child also cannot speak, for example, or there are difficulties or the quality of speech becomes lower. Or another option, when, for example, there is hypotonia, then the child also suffers most often in the quality of speech, because even to form and reproduce a particular sound, they lack, yes, innervation of the speech organs to position them to say it clearly. Here, but if we talk in the context of speech, I can talk about this for a long time. So these are the first markers, yes, about physical development, emotional development, about the preverbal period, when the period of initial speech begins to emerge. Eye contact, emotional reactions of the child. It's important to do a checkup, I think, for medical professionals, yes, to also pay attention to these various processes and send for additional examinations in a timely manner. That is, for example, yes, to examine hearing. As far as I know, in the maternity hospital, right after birth, they definitely examine it. And yes, but still there is a tendency that it's worth doing it again, for example, as a repeat.
Absolutely.
And now I would say probably a new direction. It is not as popular or, evidence-based as it might sound. The issue with metabolism in children, that is, yes, more and more parents appear when children start having colic. So these are the first signs when something is not okay. Well, yes, and the child lets you know through their behavior. And here it's important, I would say, to pay attention and find the cause. That is, yes, when children might have, for example, atopic dermatitis or some external signs. This is also, in my opinion, important to pay attention to. And very often, what I'm getting at, parents come and say they discovered lactose intolerance. And even such things also affect the mental and speech development of children. To, yes, control this, check and notice these things.
Yes, let's go back a little to childbirth because I'm also very, very interested in this. For example, difficult childbirth or, hypoxia indeed, or vacuum was used.
Or mechanical.
Mechanical, yes, this is already aggressive obstetrics, right? And women also need to understand that if childbirth occurs and there is very aggressive pressure from above, it can also have consequences for the child later. What are the most significant pathologies in these children if such childbirth was conducted?
Honestly, since, a large number of children come to me, yes, and besides, all the children actually go through me. I then distribute them to the team, so I have a large sample, let's say.
Yes.
If we are talking about the natal period, starting from whether it was an emergency cesarean or a planned one, yes, and the reason, what was the reason that it was necessary. And as you already mentioned about asphyxia, yes, about aggressive intervention, about vacuum, forceps, and so on. I understand that you were asking what I would include here. What color was the amniotic fluid?
Well, yes, because if the waters are green, we understand that.
And what else can be added here? Your opinion might be interesting here, for example, regarding epidural anesthesia and oxytocin. That is, when there is intervention from this side as well, how significant the consequences might be. This is a counterpoint, but as a medical professional, I'm quite interested in hearing this opinion too. If we talk about the consequences, and I repeat, then about the compensatory abilities of the child, I have clients who come with a very complicated medical history, I would say, starting from the perinatal, natal period. But when I look at the child, I am just amazed that I can't immediately believe that with such a history, everything can turn out, more or less balanced. Yes, usually there is still a need for correction, but the expected consequences are much greater. And in the history of women, how to say it, nothing was found, everything was fine, like screenings didn't reveal anything, everything was good. Yes, so yes, and here too the question is maybe not everything was fully examined or not everything was paid attention to, but there are such consequences that I often cannot reconcile how such a thing is possible. That is why it is difficult to talk about the tendency of what kind of disorder will occur if there is such a history, or if there is such a history, I say, because there are parents who seem to have everything perfect, no entanglement, and everything was just as the book says, and they can have complex consequences in the context of both mental and speech development. And sometimes it happens that really it seems the child should have had, a serious diagnosis from birth, but they compensated quite well, speak, and have some moderate level of speech impairment. If we talk about what generally exists, yes, what people come with and so on. Well, I think it's important for me to say before that, yes, to convey the idea that parents, as much as possible, because now it is the 21st century, access to information is incredibly open. And on one hand, this is an advantage, but on the other hand, it is a disadvantage. And especially parents who have a heightened level of anxiety, it's very important for them to filter information because it actually gets passed on to the children. Increased anxiety, expectations, demands on the child. And this is usually noticeable firstly in the child, and secondly, it is very evident in correction, where it slows down some processes. Therefore, I will share information, but I definitely wouldn't want you to, compare it to your child, apply it. Yes. Well, probably everyone does that, but be mindful of yourself in this regard. Don't believe everything immediately. It's better to consult a specialist who can truly confirm or refute a particular case. If we talk about the consequences and what might happen, now I have to mention the trend that there is currently a significant increase in children with autism spectrum disorders. And if I go back 7 years in my practice, and in a day I had 10 children, out of those 10, 2 or 3 had autism spectrum disorders. And if I look today, out of 10 children, 7 or 8 have autism spectrum disorders.
It means autism.
Yes. And
Such a large number.
This is the trend today. The only thing I might have is the thought that we are recommended as, although we do not position ourselves, yes, as children, that we work specifically with this disorder. But our reviews will probably recommend us, so they come to us. But the trend is that out of 10 children, 7 or 8 have this disorder.
This is a very large number.
This, I would say, if you name the emotion, it's true, it's scary. Yes? And this is our reality at the moment. That is, yes, we will need to adapt differently. Yes, that is...
And it is important to remember that these children need to live in our society, go to school and grow up. This is our society, and most importantly for parents to remember, because if there are children, there are also parents and older generation who do not understand that there are such children like that. And they are also quite harsh, and they do not teach their children how to behave properly, how to react to all this. This is also important.
This is a separate kind of...
I think we have a very interesting period ahead, because there is one side that is expanding greatly now. Yes, it's the issue of inclusive education.
Yes.
Children with inclusion. And the other side is our military, who will be, who are already here. So both this and that are about adaptation, both ours to them and theirs to us. Yes. Integration, introduction, combination, yes, coexistence, development.
Common society. Essentially the emergence of a new society, right?
Yes, and in this sense, it's really great to engage in educating parents and colleagues, because even fellow educators are not all ready for this. Although now in educational institutions, it is already an active, let's say, section for learning, a separate subject, because without this, there's no way forward. But ahead, it is worth developing probably empathy, understanding, yes, deeper. How to behave, how to help if asked, or those who cannot ask, yes, how can I help, support? And in the context of even our parents, we conduct psychological support for parents and educational activities for parents. And also I hear very sad and bitter stories, whether they are our clients or not. Just a mother can be walking with a child who has an autism spectrum disorder, and the child may cry and scream or may not feel boundaries, approach someone and not understand the distance to stand at or shout loudly, for example. And society, the first reaction of people who, and actually to me it's strange even now, there are still people who don't know this and they may not be aware of it at all. And the first reaction of people is like, calm your child, raise your child, like, what are you doing? Well, I mean, a lot of...
A very negative emotion is coming.
Yes.
What kind of parents are you? What kind of child do you have?
Not understanding the depth that it might not be a matter of upbringing. This may be a question about physiological processes, needs and characteristics. And here, yes, about tolerance, about educating people who are not even involved in this. So I urge people, colleagues, to talk about it. Yes, to spread this information to children, at least to tell the basics. Yes, to friends. And in this way, we can develop a bit more tolerance in our country.
And how do we tell more? Let's now describe or paint a portrait of this child so that people understand that, yes, with such a pathology, one needs to adjust to react to this calmly.
Well, I would probably return to the previous question in the context of, yes, what is generally there. Then if we first identify, yes, a psychiatric disorder, it is autism spectrum disorders, which are the largest, most common. Next, attention deficit hyperactivity disorder. Here. And in the 11th medical classification of diseases, it is slightly changed now, but overall, there is such a conclusion, I would say. Delay in speech development, delay in psycholinguistic development, and general underdevelopment of speech. 1, 2, 3, 4, there are 4 levels. First of all, I don't quite use this classification. It doesn't seem justified to me. And as a specialist, it's unclear which direction to take in correction. Therefore, I use another classification, but I will just outline the symptoms without naming them so that people don't start Googling and looking up more, because there's a lot of different information on the internet. Here, first of all, if we talk about general symptoms, what can be noticeable is when, let's say, red flags for children with autism spectrum disorder, lack of eye contact. It can be self-aggression or outward aggression. That is, children may hit themselves or hurt themselves, or they may react aggressively to people outside. They may bite, hit, throw things, and so on. Then there are stereotypical movements. Most often in children with the autism spectrum, it's flapping. These can be other stereotypical actions such as rocking, stroking, fiddling, or head nodding, any repetitive stereotypical movements, that is, unnatural, unnatural, and often repetitive.
And we will always notice them. We will notice this child.
In some cases, yes. If the child is undergoing correction, it will manifest less, yes, but it will still be noticeable. So if the child doesn't really respond to you, if you call them and they don't respond to their name, yes, you can understand that too. A child may be nonverbal. If they are nonverbal, it may be accompanied by vocalization. And what is vocalization? It is the utterance of vowel sounds like E, U, or it may remain at the babbling level, yes. In another case, there may be delayed echolalia or such learned phrases. For example, from some cartoon, any phrase like, hello, what's your name? And the child can also use it. They approach, they might repeat some context from a cartoon, a fairy tale, a poem, and such things several times. This can also be noticeable. What else can we do? What else can be added here? Fixation on certain elements. For example, if such a child is near you and, I don't know, they like your bracelets, they might fixate on them and want to take them and look for them, or until they get them, yes, not switch their attention, and accordingly they might be emotionally labile. And emotional lability is also one of the symptoms. Here she might laugh, and here she might start crying, like, yes, or here she laughs and here she is already angry and might hit herself, for example. So yes, emotional lability, when a child cannot control, yes, manage their emotions, and they can be very changeable even without any external signs affecting it. And such behavior can be more chaotic when there is no, focus. On one hand, there can be fixation, and on the other hand, the opposite, a lack of focus. That is, a child might be looking somewhere, but actually looking past certain elements. Further, if we talk about children with attention deficit hyperactivity disorder, well, essentially, the first thing that suffers is attention. Yes, so due to the low level of attention, they may not maintain healthy contact, may not respond in time when called or spoken to, not understand active gut, they're constantly moving, fidgeting, helping themselves compensate for their need with some activity, some movements, yes. In more critical cases, they will be moving around the rooms, yes, or wherever you are, in whatever space you are, they won't be able to stop anywhere, meaning they will switch to wherever they turn their head. The impulse will go there and they will follow the impulse. Well, in the context, if we talk about speech, very often the understanding of speech suffers. That is for a certain category or for some disorder. The first sign is when a child cannot follow any instruction, like give me, what's your name, how old are you?
Doesn't hear.
Well, not hearing due to physiological hearing, yes, but due to phonemic perception, through the cognitive sphere, through, well, a different set of reasons why they don't hear, but it seems, yes, as if they don't hear.
Ignores, right?
You could say that. So understanding of speech suffers. Accordingly, following instructions, requests for interaction, and in principle, interest in interaction will be lower. Why? Here, it is also very important to understand that there are separate speech disorders. And there is, for example, a psychiatric diagnosis like autism spectrum disorder. And here is also a moment when well, now it seems to me there's a bit less of this. They might not fully differentiate where autism is, for example, and where a speech disorder is, which primarily has the symptom that the child has impaired, reduced understanding of speech. And then there's no autism here, just the child, for example, has a low level of phonemic perception. And there, conditionally, well, due to the fact that she doesn't really understand what is wanted from her, she kind of loses interest and attention, yes, to respond. And but there is nothing in common with autism spectrum disorder. So it's important to understand that it's necessary to expand, yes, or these markers to like, or not to immediately worry, raise the alarm, but to go to a specialist who will understand this, yes, to the SLP.
Says what needs to be done next.
Exactly. There you go.
Presenting a false diagnosis, which is also important because there will be consequences of this.
This is 100%. Here you can continue.
Yes. Such a separate, actually painful topic there. And let's wrap up.
In the context of symptoms, if we talk about receptive language, it's how I understand, process information, and can execute, perceive, and reproduce it conditionally. And there is expressive language, which is the process of speaking, meaning how I speak. And speaking about the symptoms of various speech disorders, we can mention first when a child may struggle with the syllabic structure of a word. Simply put, the child says dog, should say dog, but says ka. Or says like dog, but it comes out as baka. Or their sokaba, that is, they can swap syllables, omit certain sounds, certain syllables, and then in the context of speech quality, how it, yes, sounds will be unclear. So when a child of 4 or 5 years old comes and Jana Stanislavska, let's say the speech is unclear to others. Consequently, the child cannot express their needs. Accordingly, she starts either withdrawing into herself or, on the contrary, becoming aggressively angry. Why does no one understand me? Oh, why did they get the halpiyat? And in the context of speech quality and the speaking process, this is when children have tone disorders, meaning hypertonia or hypotonia. Then accordingly, sound speech suffers, yes, prosody, when there can be a fading quiet voice. Well, and this is also general picture. Such nasality can occur, and it's also not always clear what the child wants to say, and so on. Here's another aspect. When a child consistently makes grammatical errors, has difficulty with mastering genders, tenses, pronouns, that is the agreement of nouns with numerals. These are repetitive mistakes, and it's hard to understand even the meaning of something like yesterday. When is that? For example, tomorrow is there, yesterday is what we did yesterday. These are also important cognitive processes where analysis, synthesis, and cause and effect relationships need to be understood. That is how it happens.
And refer to specialists.
Jana Stanislavska, of course, of course. Well, these are probably the most striking symptoms to pay attention to. And in the context of what is most common now, it's the need for early correction. That is, the advantage now is that I believe Ukraine has the strongest correction. Our clients went abroad I actually hear from all the parents, and all the parents come back to us because they're in Europe. There is great adaptation and integration, but they have no concept of correction. And we have great correction, yes, but adaptation needs a bit more. Yes, unfortunately. But in any case, I am proud of this part that we are moving forward, we are developing. And what am I getting at? About the fact that there is now quite a lot of information and opportunities for early intervention. That is, we noticed some red flags that 1 year came for a checkup, gave recommendations, whether at home, within the home, yes, worked with the child. If there is good progress, if there is no progress, then please at 1.5 years, we start correction.
A year and a half?
Is this the youngest child you have had?
Yes.
1.5 years, that's a very small child.
Yes, if we talk about red flags that are noticeable already in a year. So yes, this is a great initial stage for the child to adapt, to start paying attention to the area where there is a slight delay, there are difficulties.
I have a question for you. Tell me, please. I saw that abroad there are music schools starting with children from 9, 10, 11 months. This is when the child is just crawling, just doing something and hearing some sounds. And then this child is already in society with other children. And this is such a music school for small children. Do we have something like this?
We don't have that, but thank you for the idea.
It's very nice. I just watch and think the child went to music school at 1 year old. I see them playing, splashing everything, and there are so many sounds and everything. And I think this is also a development for the child, which is necessary.
100%. We conducted sound healing, but we did it for children with autism spectrum disorders. But actually, it's a very cool, great concept because first, the first sensory analyzers through which a child develops, yes, are vision and hearing, yes.
And tactile, probably, when you touch.
Tactile, of course, and taste, essentially the entire sensory system. But the process of speaking is the most significant. It occurs thanks to 2 analyzers, so it definitely has a good positive impact on the child immediately. If we talk about this period in general, it is very important not to limit children, meaning to give them the opportunity to explore, touch, put things in their mouths, and climb. There are different textures, different materials, different colors. This is very important. And, I clearly remember even parents ask, why is it like this now? Why like this? Not like that. So there's a whole separate topic, but just recall our childhood. Okay, I'll speak for myself. We dug in the dirt, climbed trees, we did all sorts of things. So yes, and our vestibular system, proprioceptive system, tactile system were connected quite differently. I just remember how we spun around, climbed. We jumped over, that is, we engaged all the important systems, which I would say are now primarily suffering in children. That is, yes. And
why? Because today the phone is being used?
One of the real reasons it will also be there. I mean, if we take it in general, and there a little finger, okay, is engaged, but compare it to when we were in the sandbox, when it was the earth, when we collected leaves as money, yes, there, I don't know, glued something, cut out, did something. Well, these are completely different things. So here it is 100% important not to take this experience away from children and to provide it. And even if we look at it overall, let's look at 5-6 years. That is, no matter how it was, 3 years of war, children were limited in communication. Yes, the first year of kindergarten was still limited.
COVID.
And then we have COVID. So in fact, a person is a person, generally a social being. That is, their development is directly interconnected with society.
With another person around her.
Exactly. And when the pandemic happened, everyone stayed at home. And then I completely understand parents when there is no other choice but to give a gadget. And it is so logical and understandable, and there is no communication with others. And plus the ongoing war, and that's stress and also a limitation of social interaction. And these are additional consequences, which are not the main ones. They are definitely not the main ones, but they are accompanying and can, yes, certainly reinforce certain delays.
Yes, this is also very important. So it's necessary to remember to seek help in time and pay attention to the child. Sometimes parents do not notice that their child has a problem. For example, we listed certain symptoms, and yet parents think everything is fine with the child. They do not notice. Maybe a specialist, or maybe the specialist also does not notice. It can even happen that the pediatrician does not notice.
I inhale and try to exhale. Actually, this is a very painful topic for me. The issue of the medical side is quite a painful topic. And the issue of parents, well, here I probably have more understanding. Yes, my psychotherapeutic education comes into play, right? Because noticing, acknowledging, accepting is very difficult. And many defense mechanisms are triggered in us. And if we talk about all the stages of acceptance, like denial, anger, bargaining, and so on, it's clear that while parents go through them, some precious time may be lost. How much can this be influenced? Well, you can, if you direct them to a psychotherapist in therapy, yes, have support, consider it, and go there. But it's very scary, it's painful. And in this situation, it's bitter because the child suffers. I have cases where a child was kept at home until the age of 7 because it was noticed that something was not right. But in the village, it's like, what will people say, right? And they kept the child at home until he was 7 years old. And at 7, the boy had no speech, no self-care skills, basically nothing. But only in his 7th year did the realization come that, in short, something needed to be done. And in the context of correction, the later children come, the more complicated, longer, I would say. Not that it's ineffective.
Consequences.
Well, yes, it's much more dynamic when a child from an early age, that is, we can already be in some moments of development, in some moments of correction, then the results are great. But when the child comes, yes, already an older preschooler, younger school age, then the results are significantly slower. And, well, it's more complicated, it takes longer, it's more difficult. And you can't always achieve the desired result. That's why, precisely about this part, about the fact that...
It's probably very difficult for parents to accept this too, right?
Yes.
Very. I imagine that parents expected a healthy, beautiful child, that everything would be fine, and now they have to accept that something is not right.
It is necessary, and you need to allow yourself to experience the emotions that parents, both mother and father and relatives and so on, encounter. And at this point, I want to support the parents and probably, first believe that everything will be great, because any situation, well, it can definitely be painful somewhere, but about the part that, well, like children with various delays reach a very good level, well, it's not the end, and so on. I mean, there are very cool, great cases, more of them, cases where children compensate well and have good results. Well, the statistics, well, 70%, which is quite, well, as it may sound, yes, reach the norm, right? But mostly it's not even noticeable. You wouldn't even say, like, did you have something there, right? Or there we have, yes, there's another disorder, but even the psychiatrist removed it from the record. Like, we're like, great, all right. And it's about noticing in time, as much as possible, admitting it, and starting to take purposeful actions. And the best thing for me is being gentle with oneself, being eco-friendly. It's going to a psychotherapist to receive psychological help and support there, knowing that in this place you will definitely not be judged. They will support you and accompany you on this path. And all the stages of acceptance that will come, and they transition. It doesn't mean they go in order, and their duration in the stages of anger, denial, bargaining. Well, every mom or family can be in their own period. So it's great when there is subjective opinion, support from the outside, which will be, well, support at this moment.
Yes, this is very important, and I am watching. But there is another aspect. We talked about this, and I thought there is another side to all of this when the child has no problems, but the parents think there is a problem. And they take the child to all the institutions and think, no, there is a problem. But specialists say there is no problem, everything is fine. Maybe just wait a little. Your child needs more time. This also happens.
I'll be honest, it's rare, but it happens. That is usually, these are parents with a heightened level of anxiety. But again, how to put it? That is, there is no urgent need, for example, for correction. But again,
But for some reason they think so. They somehow bring them to this specialist. There must be something.
and for me, this leans heavily towards psychotherapy. That is to analyze why I am looking for some illnesses in my child. So yes, and then this will be a topic for another podcast. I understand. But does this happen? Rarely it happens, yes. But as a rule, is in some cases, well, parents intuitively feel and follow and work. So I can't say probably, well, out of 100% of such cases, well, maybe 3.
That is, parents usually understand that something is hanging.
Yes, yes. On the contrary, I would say I feel more aggression when parents come from 1.5 years old and reach us at 3.5, 4 years old with phrases like, we've been everywhere and they told us everything is great. And when I see a child, well, I'll be honest, to avoid using bad language, I really get very angry at this point because, well, the child could have been helped. It's not that the parents ignored it, everything is fine, but they actually came on time. So how can you not notice some difficulties of the child? So this, and then this is the second topic, which concerns the medical professionals.
Oh, I just wanted to ask you, what is this? We are quite tolerant, but such a situation also occurs when doctors underestimate the problem, and sometimes they don't want to refer to someone because they think there is some peculiarity they don't want to refer. This also happens.
The most probably infuriating phrase is, wait, by 3 they will start talking. This is a myth?
Myth, yes.
In other words, roughly speaking, the process of speech and mental development is a process that physiologically occurs from birth, just as a child physiologically holds their head, turns over, sits, crawls, and walks. So physiologically, like they vocalizes, babbling appears, cooing appears, first words, first simple sentences, and so on. This is a physiological process, and when everything is okay, it should be there. Svetlana Lyashenko. Well, yes, like, I don't know, I want to go to the bathroom, I go to the bathroom. This is a natural process. And if this process does not occur, then it means something is not right. Or
Yulia Kravchenko, why is that?
Svetlana Lyashenko, is there some chain that needs to be adjusted, right? So again, whether it is maturing, yes, but this process needs to be pushed to activate more intensively. It depends on the situation, right? Because we have real disorders, there is, well, a delay. If we are talking about a delay, then that's one part. If it's about some disorder, then that's another part, yes.
Yulia Kravchenko, I see, very interesting. I'm very curious. And another question, if indeed a child makes cooing sounds and everything else, grows up and the child is already 7 or 8 years old and still doesn't speak, but the child understands everything. Understands that they are being addressed, everything else, but speech has not started. What to do next? The first question is, how should she be in society? Does this child go to a regular school or does she need something else? And the second, is it possible to correct this at this point in time?
Svetlana Lyashenko, at that age, well, I will probably add about the part that now inclusion is being introduced already from, let's say, the middle preschool age. That is, for example, if earlier it was done more when the child goes to school or very rarely in kindergarten, now inclusion can actually be introduced even from an early age. Svetlana Lyashenko, state takia, state patekat, right? So in state institutions, an assistant is provided who will be assigned to the child and accompany them in educational forms. How much it exists and how good it is, that's another question.
But I'm still glad because really I personally notice a trend. So if you compare how it was and how it is, we are still moving at our own pace, yes, with our own steps, but I think it's great. So if we return to the question, is it possible or impossible to compensate? It depends on many factors. So, for example, if by the age of 7 nothing was done with the child, no research, in other words, ignored, let's say, roughly speaking, then I would say it's 50-50. So we return to compensatory possibilities, return to the mechanism. Why does the process of speaking not occur? Because very often the process of understanding and the process of speaking is, in some disorders, both suffer. In some cases, only understanding may suffer, while something in the context of speech may be present. It can be the opposite. That is, speech is absent, but there is excellent understanding, for example.
That is, it depends on the situation.
And here, in fact, this is a topic that has no end because it will depend on the comprehensive work of doctors, special education teachers, and the active involvement of parents. That is, a full checkup of the child means referring to a neurologist, yes, referring to a metabolic specialist, a psychiatrist, an audiologist, and, if necessary, an otolaryngologist. And there, well, at least a basic list to see if everything is okay or not okay from a physiological point of view, whether help is needed, medication, or some other treatment methods, for example, right? A separate topic is unconventional correction methods. That is one of the controversial ones, I would say, in the world.
Yulia Kravchenko, in general in medicine.
Svitlana Lyashenko, yes, something like that. From the context of that corrective education, it's also important to understand, and in this case, to really emphasize, each specialist has their own area of competence and responsibility. That is, a speech therapist works on speech understanding. That is the process of understanding, the process of speaking, the grammatical aspect, the sound of speech. Because for most people, let's say not everyone, the first association is, what does a speech therapist do?
And what does a speech therapist do? Talks.
Okay, but actually, everyone's first thought is like setting the sound R.
But actually, speech therapy is probably the easiest thing there is. And I don't remember children who just came to work on the R sound. I practically don't see such children in the center anymore. And here it's about the part that both specialists and doctors don't fully understand. Like, what does a speech therapist do? Parents don't understand.
Question: do we need to work on the R sound?
Do I need to put a comma?
To the parents, the child? Well, I mean, parents set a requirement for the child. Is it necessary? We know many successful people in the world who don't pronounce this sound, and they live, and everything is fine. So, the question.
I would say, if a person is okay with it, well, it can be left undone. So it's probably more like, well, ideally, why is it great to do this in childhood? Because the child goes to school and then starts reading, writing, and there can be difficulties. When a child doesn't pronounce, they don't hear this sound. But in general, if there is no bullying, no teasing, and the child is fine and the mother is fine, then I have acquaintances who don't pronounce many different sonorous sounds like L, R, and so on. They say, it's my thing, like a French guttural. Well, if people are okay with it, then there is absolutely no need for it.
Understood. And another question, can adults come?
Adults come.
Do they also come?
Yes, there are 35, 45. A civil servant also came to us. He says, yes, I work in court. I need a good art sound because people don't understand me. And that's great. There are cases of adults who are concerned about their speech sounds and work on it, but it's important to understand that the client's level of motivation must be significantly high. Why? Because for children, it's at a subconscious level, like 1, 2, and it's set, automated. But for an adult, it's like a skill formed, long established to retrain oneself to speak sound differently. So if we return to the fact that each specialist has their own direction, in the context of speech therapy work, it will concern speech, well, understanding, speaking, grammatical, that is the quality of language, sound language, activation of speech, because a speech therapist works precisely to activate.
We have an active vocabulary and a passive one. Passive is understanding, active is what we speak. That is to initiate, to activate these processes. If we talk about a psychologist, again, a correctional psychologist, it's about the development of the cognitive sphere, the development of attention, memory, perception, thinking. Emotional and volitional sphere, yes, what's happening with my emotions. When children are emotionally labile, when, for example, assembling a pyramid requires volitional effort. And to stack 5 rings there, for some categories of children, this will be difficult. So in the context of a correctional psychologist, they will work specifically on the cognitive sphere, emotional volitional, for example. And this also includes socialization. That is, when I notice that there is someone else, I notice that I can interact with them. Yes, and I am not crying. That is, I can be there. I can even communicate with this person. Yeah, and so this side is the responsibility of the correctional psychologist. There, if we are talking about a sensory therapist, a rehabilitation specialist, therapeutic physical culture, that is everything related to the body, this specialist and such, actually, I would say this area cannot be ignored. Why? Because everything is directly related to general fine motor skills, because we have general fine and articulation. That is, if a child has an imbalance at the level of general motor skills, general praxis, why there? It is often necessary to develop fine motor skills, but everyone forgot about the general. Well, I mean, really, that's why these specialists will be responsible for enriching the sensory analyzers of the vestibular and the proprioceptive systems, the different skills and qualities of physical development that greatly influence the development of the cognitive sphere. Because the body allows for the regulation of hyperactivity and attention deficit. That is, the body compensates for certain processes or through the body. For example, when seshta, when excitation processes prevail over inhibition processes, the body helps regulate these processes. Therefore, because often parents say, oh, we only need a speech therapist, and they don't give importance to the fact that, well, okay, but before, let's say, the results of work reach the speech therapist, the child also needs to be ready to accept it. Well, that is, she needs to build a foundation, right? And first connect the body, then the cognitive sphere, and then, okay, the child notices me, and then I can take other actions. That's why, I mean, every specialist has their own area of expertise. The same applies to medical professionals. Yes, each specialist, well, I don't know, an ENT deals with one thing, right? And the gynecologist deals with another, logically.
And there's no need to interfere with each other.
Yes, even though we may understand some processes or no, right? But the dynamics in work are much better when everyone has their own area of responsibility and
a narrow specialty, even a narrow direction already now. The specialty is one, but everyone has their own directions. Well, you still need to understand that part, yes, but probably divide certain, let's say, responsibilities. I have one more question. I really want to ask about the frenulum, the short frenulum. So tell me, does it need to be cut or not? At what age? What is your impression?
Is there no exaggeration with this?
honestly, I'll say I've been in practice for 14 years.
Yes.
In reality, during this period, I probably had only 2 cases where there was a need to cut the lingual frenulum or the labial frenulum. In other cases, there is no need for this.
Why do they do this?
Again, at the birth, the midwife who delivers the baby sees how much the tongue is cut. If anatomically, well, let's say there is a need for it, then it's best to do it immediately. Yes, if this issue arises later. And here too, there's a point, yes, about how actively the child latches onto the breast. If, for example, no, it could be a matter of one issue, the issue of tone. On the other hand, it could be a matter of a short lingual frenulum, that is to consult a pediatrician, check. If the tongue can be lifted slightly to the upper teeth, great. If not, then attention should be paid to this. If we are talking about early age, middle or preschool age, I don't see the need for it. Why? Because, well, the tongue is such a thing, it's, not a tree. It can stretch. That is, the tongue is flexible, and even just articulation exercises in my cases develop well enough, stretch the lingual frenulum to form certain phonemes.
So overall, there is absolutely no need for this.
And you know, there's also something I don't know, a myth or truth, that if the frenulum is short, then the tongue is not up but down, and then it affects the bite, leading to a misaligned bite and other issues. Is this a myth or reality?
Well, I think if the tongue is really truly attached, 100%, it will affect it, because the tongue won't take its correct position.
Then already.
Accordingly, yes. And if we say that in principle the tongue is within the norm, meaning the child can still, stick out the tongue, can, lift the tongue up and so on, then it's about skills. There, even the same now, like pustunchik, how do you say it in Ukrainian?
No, pacifier, huh?
How is that?
Grant us mercy for help. That is.
When we edit the podcast, we will write a new translation.
Okay, so even if a child uses it for a long time, yeah.
Well, a pacifier?
Pacifier. We said it out loud. Okay, so this already forms an incorrect bite in the child.
If for a long time.
Well, okay, if we say the child is given it once a week for 15 to 20 minutes, it's not a big deal. But if we say the child sleeps with it.
Sleeping, yes.
Yes, there for the afternoon or night sleep, if the child, when they just cry, is immediately given it in the mouth, accordingly, the tongue takes a different position, and then the child develops an incorrect tongue position, which has consequences. ENT pathologies, if we say the child cannot breathe, the mouth is open, this is also a factor. So anatomically, the tongue cannot be in the correct position because the mouth is open. There are many, let's say, reasons that can affect the development of an incorrect bite, right? Overall, it's really interesting. So many topics, yes, and orthodontics and much more.
ENT pathologies. I mean, I really have so much enthusiasm for this field.
Yes.
You could even make a series of podcasts.
You know, you can talk like this with everyone. I talk to each person and think, it seems to me we could talk and record endlessly, and the topics are so great. So I thank you for being so passionate about this topic, for living this topic. It is felt. And everyone who was at Yuzko Studios are also professional people who are passionate about their subject. And it's really cool because at some moments I feel goosebumps from the information I receive. So thank you. It was very, very nice to talk and hear such cool information. And I want to address our viewers, asking them to write to us, comment, like, and share us. Oh, maybe there will be a gift for sharing, like you can.
Yes, I have a very cool idea, a suggestion. You can share your insights, yes, or what new useful things you learned at our meeting today. And there's an idea, for example, you can share a checkup.
By letter?
Checklist. Thank you. Share a checklist of specialists whom I recommend consulting first when we comprehensively approach the question, how is my child developing? Is everything okay? Okay. Here, or you can, or also additionally, share a guide on which useful toys to buy for your children.
Super.
Yes, whether it's musical instruments or, stacking toys, and for what purpose and what is best for it to be, the most beneficial.
Super, thank you very much. So be active, because as you see, we have such nice presents.
Great. Thank you for the invitation, for such a cool, easy atmosphere. It's very important, and I am impressed that you are developing this direction. It is very useful. I think many people will find answers to their questions.
Thank you.
And thank you for being with us.
Thank you. See you.